what is obsessive compulsive disorder, and does CBT, cognitive behavior therapy, really work on it? So I wanted to start this video by giving you information directly from the professionals. So I found this information from it's by an American institute called the Mayo Clinic, and this is what they say about what OCD is. So I'm gonna read it to you directly. Obsessive compulsive disorder is a mental and behavioral disorder in which a person has intrusive thoughts and feels the need to perform certain routines repeatedly to relieve the distress caused by the obsession, to the extent where it makes a normal daily life impossible. These unwanted thoughts and fears are known as obsessions. These obsessions lead you to do repetitive behaviors, also called compulsions. So this is the short version of what OCD actually is. Okay, and the thing is, one would think, okay, so why does a person develop OCD? What causes OCD? And the honest truth is that the mental health, they can't give you an exact reason why a person develops this. They can't pinpoint it on anything. They see patterns, they see causes, but they can't tell you this is why you have developed it. But some facts are biology, genetics, and learning behaviors. And there are risk factors, and I'm going to read them to you. So there are risk factors as family history, stressful life events, and other mental health disorders which lead you to develop OCD. So for example, if you grew up with a parent who is very pedantic and needs to clean all the time and like have these obsessions, they can actually make you how do you say this? It will make it easier for you to develop it because you see this behavior and it's a learned behavior. Other facts are traumatic events. So if you've gone through something really traumatic, it can make it easier for you to develop OCD. I liken OCD as being a marionette doll. So I don't have a doll here, but I'm gonna try to explain a bit what I mean. So the obsessions for me are the hand, and the compulsions are the strings, and I am the doll. So when I get an obsessive thought, so it starts and it's like telling me, like it's going crazy in my head, and the anxiety rises and rises and rises till it actually starts becoming that I need to do something. I need to do something to relieve the anxiety. So the strings, the compulsions are the one that starts directing me. What should I do? What should I do? And in my case, I'm obsessed with dirt. I'm obsessed with the thought that I don't want to get dirty. So usually when you have this obsession, you're afraid of contamination, of getting sick. That's not actually my situation at all. And my psychologist in the beginning, they had a bit of difficulty to understand this, because I am not afraid of getting sick, because I know, I don't know how to say this in English, but I know that if I just, stick my hand in a garbage bin, I won't get sick unless I'm stupid enough to take my hand and put it in my mouth. And then maybe I can get, have problem with my stomach. But I know logically I can't get sick. I don't die because of some dirt. But that's not my issue. My issue is that I'm obsessed with thought. It's dirty. So I feel dirty, and I feel like anything I touch and anything that touches me is dirty. So I need to clean. I need to clean everything I touch, and then I need to take a shower and throw my clothes in the washing machine because I can't handle it. And the thing is about it is that this is a vicious cycle, because the compulsions that makes you do these routines, they trick you into thinking, okay, now I've done this, the anxiety is over. And it is over for a minute or two. But then it starts over again. So it's like a vicious cycle, and it never ever stops. It never ever stops. And I've had this for as long as I can remember. My first memory of my OCD, I was around 7 or 8 years old. So I was still a child. And that's when I actually remember that, oh my goodness, something is wrong with me, because I'm doing something really, it was bad. So so I know that it started before that, but it had turned into something really, really serious by the age of 8. And I've struggled with this for my whole life. And it wasn't until I started get therapy for this, that I started to see some changes. But the thing is, the therapy is not adjusted for autistic people. So the healthcare system here, the thing is with me and my autism is that each situation is a new one for me. So I need to practice on everything, and the healthcare system doesn't have the resources for that. So it ended with them after 19 years. They gave me 19 years. That's a lot of time. But after 19 years, they told me that, we're sorry, we can't do more for you because your OCD is so severe that it's not, we don't have the resources for it. So when that happened, I decided that, okay, I'll do what I can, and the rest, I'll just leave it. And what they use here in Sweden, the only thing that is offered for OCD is CBT, cognitive behavioral therapy, and it works. It takes a lot of time. It is not an easy treatment. Therapy. It takes a lot of effort and time, but it actually works. So what they do is that they teach you to retrain your mind and to meet these obsessions, to work against them. So when I get an obsessive thought, I am taught to stay in the thought, stay in the anxiety, and work against it. So for example, if I touch something and I feel like, oh my God, it's dirty, and my obsession starts, to stay in it and not do anything about it. So to go against the anxiety, to go against the obsessions. And this is not easy. It takes a lot of time, but it works. If you are willing and you're receptive to therapy, it will work, and it will make your life so much easier. So what I do now is that I work with what I can. I have the tools now. I know what CBT is, how to think, what to do. So I use what I know and I work against it. And the rest that is too much for me, I just leave it. But my life today is much more easier than it was 10 years ago. And I'm so thankful for it. But I know that I put in the work for it. I had to work my butt off. But I know it works for me. And if you have OCD, it will work for you as well. So let me think, what did you think of this video? What did you think of this topic? Do you want more such content? Thank you, and I see you in my next video.